It's been held up as a shining example of a broken VA system nationwide. The VA hospital in Palo Alto is a clinic that works where veterans don't have to wait for care.
But tonight we have evidence that suggests otherwise. War heroes waiting months and even years to complete their care. Investigative reporter Stephen Stock is here with us and the story. Stephen.
Raj, Jess, whistleblowers have come forward to us with evidence showing a serious and long backlog of care exists at Palo Alto, too. Not on the medical side of things, but at the dental clinic.
The promise to veterans made by President Abraham Lincoln in 1865 is memorialized in bronze out in front of the VA Medical Center in Palo Alto.
They need the best treatment that we can give them.
But former dental lab technician George Geddes says he witnessed firsthand Palo Alto's VA often fall short of that promise when it came to caring for dental patients.
It got progressively worse until I left. When I left, it was the worst I've ever seen. It was pretty bad.
For 6 years, Geddes worked in the Palo Alto VA's dental laboratory, making dentures, implants, and other dental prosthesis.
I know firsthand a lot of their sacrifices for this country.
Under VA guidelines, dental care is reserved for special veterans. Not every vet qualifies. In fact, to get dental care under the rules, the veteran must be a former POW or 100% disabled or meet specific need-based criteria. George Geddes witnessed those vets waiting incredibly long periods to get things like implants and dentures.
How long were some of these cases?
The longest one I've seen was about 3 years.
3 years?
3 years in running, yes.
A man waiting 3 years for his dentures.
3 years.
Frustrated with the growing number of patients left untreated, Geddes decided to retire late last year.
One gentleman in particular, he didn't have his dentures, and he was telling me that he was so tired of drinking his food.
Don't believe Geddes? Then listen to this insider who still works at the VA.
The waiting period is just unreal.
The insider asked to be disguised and his voice altered because he fears retaliation.
Has anything changed?
None. Nothing has changed. Nothing has changed.
NBC Bay Area's investigative unit obtained copies of these logs, giving us an inside look at just how extensive the backlog is. Take a look at these pictures, too. The pictures taken in July show hundreds of cases representing hundreds of patients. Cases still sitting on the shelves in the VA's dental laboratory. Cases that are unresolved and unfinished. Some date back to 2011.
Is there a backlog here?
There was a backlog here, yes.
Dr. Avantika Nath serves as the chief of dental services at the Palo Alto VA.
How long have some patients waited in the last couple of years here?
I am aware that some patients have waited up to 2 years for implants.
Is that acceptable?
That is not acceptable, and that's why we are making the changes we are making. The staffing shortage, the support staff shortage, all have been addressed.
Dr. Nath acknowledges that long wait times for dental care was a problem, but she insists that she's made significant progress in reducing that backlog since taking the helm 2 years ago.
I need new dentures.
Right.
Do I have to wait?
You may have to wait more than a month, but less than 2.
Dr. Nath says she has actually increased staffing in recent years by hiring more dental specialists and contracting with 2 outside labs.
Are there still veterans waiting for prosthesis, for dentures?
Not at this point.
But we discovered the backlog persists.
They need to move quicker on these problems.
Just talked to veterans such as Vietnam veteran Michael Smirkowitz, who says he's seen little progress since Dr. Nath came on board.
There's just no excuse for this.
Smirkowitz says he's waited so far almost 2 years to get permanent implants. He's still waiting.
When you have teeth missing from your mouth, you feel very self-conscious about smiling or how you're going to eat, okay? You have to be careful what kind of food you eat because it actually hurts.
We found a list of over 300, and over 30% of them have been waiting for 4 months or longer. Is that acceptable?
We showed Dr. Nath the list that we obtained, demonstrating how long some of these veterans have had to wait.
We make every attempt over here to reach the patient if his denture is sitting in the lab. If the patient has not come in, or if there has to be another reason. That's all I'm saying.
So is the reason that there aren't enough dentists to see the patients to put these dentures in?
No.
No.
We have improved the staffing, and we are going to make it even better. But if there is such a factor, it just needs to be investigated.
We provided Dr. Nath and her staff with a complete list of 113 cases that are 6 months old or older.
People who work for you say it's because there aren't enough dentists and they aren't being seen, and this stuff is sitting on the shelves, not getting to veterans.
There was a point when there were not enough dentists. Like I started, we were extremely short-staffed. I have done my very best with HR's help and with our leadership to fix that problem.
Something needs to be done now about this. You can't ignore this.
For veterans such as Michael Smirkowitz, Dr. Nath's pledge to do better rings hollow in the shadow of President Lincoln's words from so long ago.
When are you going to take care of this problem? We've all waited long enough.
And we just learned that the Inspector General is now investigating this backlog to see exactly why it's taking so long to get these veterans dentures, implants, and other dental treatments. When the Secretary of the VA visited Palo Alto here in the Bay Area earlier this summer, he admitted to us that there is a problem with a serious backlog of dental cases here. Dr. Nath, for her part, tells us they're now looking into the cause of all these delays and at the list that we gave her, and she says she will make any changes as needed. We will keep following this story. Raj, Jessica.